What's up, everybody? Matty Willz checking in with yet another episode of Wellbeing Wednesday with Matty Willz. Of course, this is all brought to you by the good people at MetroHealth. And, each week we talk to a different representative of MetroHealth about different things plaguing not only people in minority communities, but people everywhere. And this week we'll be talking about diabetes with the one and only Dr. Riachy. So let's bring her on to the screen and into the fold. And first and foremost, hi, how you doing today?
Good. How are you, Matty?
I'm doing great. So first of all, thank you for taking some time out of your day. We're kind of creeping into the holiday season, and beyond that, you guys are extremely busy as your roles are super important. So we appreciate you taking some time out and chatting with us. Before we get started, I do want to give you the opportunity, just, tell our listeners and viewers a little bit about yourself and your journey and your role in MetroHealth.
Okay, first, thank you so much for having me today. This is November Diabetes Awareness Month. So this is a good opportunity to talk about diabetes. So I'm Dr. Riachy. I'm a Lebanese medical doctor. I came to the United States a few years ago for training, and I just started my journey with MetroHealth a few months ago. And this is my third year in Cleveland. I'm loving Cleveland. I decided to stay and work here.
Hey, once you start saying you love Cleveland, then you already know that we accept everyone with open arms, especially the ones who like being here, because we know that there are a lot of cities out there. So thanks for helping our community out here in the land. So, without further ado, we'll go ahead and get started. As I mentioned, we are talking about diabetes. So, I think the most appropriate question to begin is, what exactly is diabetes and what causes it?
Okay, so before we talk about diabetes, I want to talk about an important hormone here. This hormone is insulin, and insulin is produced by our pancreas basically to control our blood sugar levels. And when you have diabetes, which is a chronic medical condition, your body is either not producing enough insulin or not utilizing the insulin that is produced. And in this situation, your blood sugar levels will be high, and this will lead to many symptoms. Mainly, patients will complain of urinating frequently, more than the usual, which is like frequent urination, feeling thirsty more than the usual, unintentional weight loss, which means they are losing weight without doing any effort to lose weight. Other symptoms may include having infections, especially like gums, skin infections, vaginal infections in women. It can also cause blurry vision, numbness, tingling in the hand, in the feet, and a lot of patients complain of difficulty healing of their sores or wounds.
Okay, so, with all that said, and as a lot of our conversations have kind of centered around here on Wellbeing Wednesday, why is it that diabetes affects Black and Brown communities more seemingly than everyone else?
So yeah, very interesting question. So although like 13% of the general population has diabetes, the CDC showed that the rates are disproportionately higher in the Hispanic and African American populations. It goes around 15% in Hispanic and 17% in African American populations. And there are many reasons. Some of the reasons attributed to mainly genetic traits. So diabetes runs more in the families of the minority communities, therefore more in these patients. Other causes may be prevalence of obesity in these populations, so the higher obesity prevalence leads to higher incidence of diabetes. Other reasons may include racial disparities, lack of quality medical care in these populations, or lack of access to healthcare or like health insurance.
Got you. And then, so what exactly does MetroHealth do to provide support to these minority communities and help eliminate some of these disparities?
Okay, so MetroHealth basically screens every patient once they start their journey with MetroHealth for social needs. So social needs may include food insecurity, transportation problems, housing instability, financial strains. And Metro has developed multiple programs to work on these problems. So I could talk about a few of them. these programs. So we have at Metro the financial assistance program. Basically, what this is patients would fill forms and apply for financial assistance, and this would work as an insurance. Basically, through the hospital and through the pharmacy. There's a program also through the pharmacy, which is the 340B, and this will allow patients to receive medications at reduced cost. This is very important for diabetic patients, especially the newer medications are more expensive. So this will be helpful for them to get the medications from the MetroHealth pharmacy at a reduced cost. Other programs, we have the Food as Medicine program, which is basically providing around 2 to 3 healthy meals per day for diabetic patients to make sure they can to focus basically on their healthy lifestyle. Metro does provide multiple education classes for diabetic patients about food care, skincare, how to manage their blood sugars, how to take their medications and stuff like that. There's also the Strides program, which is a program having online classes and in-person classes. And this is for patients at risk of developing diabetes, basically giving them the knowledge about healthy lifestyle changes to prevent going into diabetes. I would also mention an important thing. Yes, you want to say something?
No. Please go. Please continue.
Yeah, this is an interesting project MetroHealth is currently working on, is the Multicultural Health Equity Center. So the center basically will provide care primarily to minorities, like minority communities, and physicians and providers in that center will be specifically trained to address barriers and disparities and specific diseases that we often see in these populations.
Got it. And then the only thing that I was going to say, all of that fantastic information. And the only thing that I was going to say is, what are some of the things that people can do to kind of prevent going down the road of, maybe getting diabetes, or maybe if they have diabetes, what are some things they can do on their own to kind of manage some of those symptoms and just having it in general?
Okay, so personal effort is very important. So we would advise everyone to try to follow a healthy lifestyle as much as possible. When we talk about healthy lifestyle, we basically mention the diet part, which is trying to eat more fruits, more vegetables, less fried food, less, especially food rich in saturated fat. And we focus about staying active as much as possible. Even 45 minutes, 5 days a week of a moderate physical activity, like just walking fast, if you want to say, not very intensive exercise, 4 to 5 times a week, was shown to be very helpful in these patients. So healthy lifestyle as much as possible, controlling food portions, being active. And whenever patients want to be screened for diabetes, especially if they have a family history, especially if they have weight problems, we encourage patients to be screened. They can always start their visit with a primary care physician for general screening at MetroHealth. And then if they were diagnosed with diabetes or pre-diabetes and they are willing to see a specialist or an endocrinologist like me, they can visit our website at metrohealth.org/diabetes, or they can call the hospital phone number, get transferred to the diabetes center. We can put the phone number at the end. And they can book their appointments with us to be able to guide them further on lifestyle and medications.
Perfect. And that is a perfect segue into me informing everybody that if you have symptoms of diabetes, or if you're worried you may have it, call 216-696-3876 to schedule an appointment with your primary care provider, or sign into MyChart. If you have diabetes and are interested in getting help to stay healthy, call 216-778-7835, or visit our website at metrohealth.org/diabetes. And of course, as Dr. Riachy just stated, we'll have all of that good information down in the caption. And the one thing that I do like to remind everyone watching, right now is, if this information is suited for somebody that you know, a loved one, a family friend, anybody that you know, please pass this video along to them, share it with them, send them the link, because we all know that health is or information is wealth, and it really helps everybody when they have all the good information. So she's Dr. Riachy. I'm Matty Willz. It's another episode of Wellbeing Wednesday. Before we get out of here, did we cover everything that you wanted to say? Is there anything that you might want to add to the end of this?
No, basically, thank you so much for having me today. Thank you for this nice interview, for raising awareness about diabetes in the Diabetes Awareness Month. And we're looking forward for more interviews in the future.
Yes, I'm hoping to speak with you and many more of your colleagues. I feel like we might be running out of people to talk to over there. We finally got to my doctor a couple of weeks ago. Shout out to Dr. Germany at MetroHealth in Cleveland Heights. But thank you again for your time. This was really good information. We really appreciate it. And we'll see everybody next time on another episode of Wellbeing Wednesday with Matty Willz, brought to you by MetroHealth.